Welcome to week 2 of the Springfield Empowerment Zone Science and Humanities curriculum. Last week we highlighted the healthcare disparities that exist in Black and Latinx communities in Massachusetts and Springfield. The data and information provided a sobering look at the public health challenges that exist within our Black and Latinx communities and how those challenges leave these communities extremely vulnerable to the COVID-19 pandemic. This week we'll evaluate just how COVID-19 is impacting our Black and Latinx population and how those previously identified health disparities continue to worsen as the pandemic continues. With no clear end in sight, it is important to remain aware of the challenges that lay ahead as COVID-19 continues to change our daily lives. As we've already learned, Black and Latinx communities in our state and throughout the country suffer disproportionately higher rates of health complications relating to cardiovascular disease, diabetes, chronic respiratory diseases like asthma, and many others. All of these underlying or pre-existing conditions help increase the risk of complications and potential death for those who contract COVID-19. What would be mild symptoms for many people who contract the virus quickly turn to severe symptoms for those with these underlying conditions. The result of these underlying conditions in the Black and Latinx communities is a significantly larger death rate for this population as a result of COVID-19. According to the U.S. Center for Disease Control, the death rate for Black Americans who contract COVID-19 stands at over 18%, while the rate for the Latinx community is around 27%. This is despite Black Americans making up only 13% of the population and the Latinx community making up only 18%. And while these national numbers are alarming, the numbers are even more stark when viewed in specific cities, states, and regions where the numbers can be much higher. It is also important to note that the numbers only represent a small snapshot of the COVID-19 data available at this time. Reporting on COVID-19 related to race and other demographic information has been sporadic and extremely limited. Currently, access to data appears to be just as unreliable as access to care. Those in Black and Latinx communities who contract COVID-19 are faced with a stark reality when attempting to access care.
So we know that in Black and Brown communities that typically these hospitals that are called minority serving hospitals, and there have been studies that have shown this, tend to offer poor quality care. And we also know that they may not have the resources to deal with very sick COVID-19 patients. So they may not have the specialists like intensive care unit physicians. They may not have the PPE or the ventilators to really adequately care for these patients.
As the nation continues to respond to the coronavirus pandemic, it is likely that these troubling numbers will continue to increase. Those numbers will increase as the economic disparities that already led to health inequity cause many within the Black and Latinx communities to expose themselves to the virus as essential workers that the nation depends on. Black and Latinx workers are disproportionately represented in many of the sectors now deemed essential in our economy, including much-needed sectors like long-term care workers. The inability of many of these workers to work from home results in dangerous exposure to COVID-19, essentially making the stay-at-home orders issued by state and local governments meaningless to people on the lower end of the economic ladder. But as is the case with attempting to obtain accurate and complete demographic COVID-19 data, obtaining accurate numbers within Black and Brown communities has been equally difficult due to a lack of testing. Across the country, access to coronavirus testing has been sorely lacking in Black and Latinx communities. The lack of testing prevents the true impact of coronavirus on these communities from being fully reported or even understood. Lack of testing has remained one of the biggest criticisms of the overall government response to the pandemic. Shortages in testing equipment and personal protection equipment has been a particular source of controversy here in Springfield. As we continue to battle this pandemic and essential workers continue to expose themselves to COVID-19, experts assert that much more testing is needed in order to ensure the health and safety of those on the front lines. Additionally, as states begin to reopen, testing is vital not only across the United States, but in these Black and Brown communities where working from home is simply not an option. Ultimately, the coronavirus pandemic has shined light on the glaring health disparities that exist in Black and Latinx communities, including here in Springfield. But as we recognized last week, those disparities existed well before COVID-19 and unfortunately will likely remain long after it. The question becomes, What can we do to begin closing many of the gaps COVID-19 has helped expose? And how to ensure the disparities that exist now don't exist forever? What solutions will you come up with to address the needs of our community? Thank you for joining us.